Well, I knew that I wanted to explore a different aspect of nursing, something that didn't involve a hospital or a big institution. I had an interest in community nursing, but I hadn't taken it yet. So I thought that by working with underprivileged populations, I would kind of get an idea of where I could fit in as a nurse, and that trip really provided that experience for me.
Medical Spanish was a huge, huge reason that I wanted to do this trip because I found that I'm conversational in talking about the weather and things like this, but when it came to diagnoses and other things like that, I was very much lacking. So in order to serve the Latino populations that I would like to, I knew that medical Spanish was a piece that I had to really work on, and I knew that this was a great opportunity to do that and to experience nursing in another country.
Here at BC, it's very easy to become disconnected from the populations that you're serving or the populations that you want to work with. So, going to Nicaragua was really an opportunity to reconnect with that passion of wanting to serve and that passion of wanting to help and empower communities. And I think that's one thing that I really got from the Nicaragua experience, was kind of like a reawakening and a sense of direction of what to do from now.
I guess I thought I knew what I was going to see when I went there, but I really had just no idea what I would have seen in the 10 days that I was there. I mean, you see the commercials on TV and the children, but it's a very limited window until you actually get there and you visit the public hospitals, which are atrocious. You see just the little shacks that people live in, and the fact that they survive on these conditions every day, when I don't know that I could last more than 30 minutes living in what they lived in, and especially in our trip to the dump.
I think the one thing that I think about the most is the city dump. That when we went to visit, it was just like, I'd never seen anything like it before. And it's hundreds of people living in cardboard boxes among trash that's just burning constantly. And we get off the bus and it was impossible to breathe. And after I left there, I wanted to tell everyone about it.
Going to the clinics in the morning and providing health care for these folks in the role of a student nurse practitioner. And, giving these consults and from the kids to the older folks, and sort of providing a needed service, certainly, whether that be medicine for their parasites or sort of evaluating sometimes their malnutrition or their malaria or these conditions that are a lot more prevalent in the third world, and feeling moderately good about myself. But then in the afternoons, again, hearing about these endemic, deeply rooted problems and understanding that the antibiotics that I gave in the morning doesn't address these bigger issues. And then asking those questions, well, what is my role as a nurse practitioner?
One question that was asked to us down there by one of the men who went to the dump with us that was really kind of like bothering me for a while, and still is that he said, like, what have you done to prevent a situation like this from happening in your country? I want to know what I can do, what you did to prevent this from happening. And to me, like, that just really hit me, because I was like, I haven't done anything. I just happen to have been born to a middle-class family in Massachusetts and had all the privilege that came along with that.
I think when you see all the social injustices of a third world country, you see the lack of support, the government, the lack of health care, food, everything. When there's nothing there and you think of what can I do as a single individual, I think it is so overwhelming. And you sit there and you're like, at times you feel like you can't do a single thing. And I think that can be one of the most challenging things of this kind of experience, because you come back and you want to do so much, but there's so many obstacles that you have to work through to accomplish something.
Every once in a while, there would sort of be this twinge of hope. Maybe really towards the beginning of the week, not much hope at all. And so I found myself sort of constantly searching for, okay, what's the hopeful thing today? What's what is the conversation that I had with someone that reveals to me that these folks do have some sort of resiliency or some sort of hope in this situation.
And the impact that the health promoters had on us, I think we went in, or at least I went in thinking like, oh, we're going to have such a big impact on them, but the impacts that we had in just our dialogue with the women there, and there was about 5 or 6 women who don't have much of an educational background, don't have any resources, but they see the importance of healthcare there and have taken it upon themselves to come to our teaching program that we did and to learn the information and then to go back out in the community. And I think that was powerful, just to hear them speak of everything that they see and how they go about doing what they do. And I would really be upset with myself if I forgot what I learned from them, mostly, I think.
Well, I think in nursing there's a lot of room for political advocacy and challenging our current healthcare system. Because I've learned to identify our healthcare system here as a violation of human rights, just because it isn't accessible to everyone. And I think that in that way it connects to Nicaragua. There's such a big health disparity there, and I don't feel that I necessarily have to go to Nicaragua or to another country in order to kind of, meet the goal of providing healthcare to others who don't have it. There are a lot of people here in the United States that, don't have adequate healthcare or resources. So, in that sense, I think that the two are very, very connected.
My philosophy did change because I was able to see what I can do in that role and what that role the potential for that role can be as a nurse working internationally. It requires such a broad vision, looking at a person as part of a family, as part of a community. You can't just treat them and treat their disease. You can't just give them medication because you need to understand that they don't have food. So if they don't have food, how is this medication going to help this one problem?
I recognize that my philosophy is that I need to follow my heart, and that, we don't all have to go the same way. And some of us will be more apt toward community health, which I think I realized during my time with the Global Health Initiative.
Whenever I feel a little hopeless or sort of get lost in the immensity of the suffering, both here and when we were in Nicaragua, I think about those folks that are sort of contemporary saints that are working in their own way and within their own powers to change the face of the world. And they continue to inspire me, definitely.
Yeah, I would regret forgetting any of it. But I don't think I will forget it.